You're watching Hindustan Times, and I'm Aditi Prasad. Aarogya Setu is a contact tracing app launched by the government of India several weeks ago. This, of course, to fight the COVID 19 pandemic. It has since been made mandatory for all employees, private as well as public sector. However, some citizens and activists have been claiming that the app is a direct assault on the privacy of Indian citizens, some 90 million Indian citizens. And this has led to a bunch of questions being asked about this very same app. To answer these questions, I have with me Abhishek Singh, CEO of MyGov.in, which has sort of made the app, which is behind this app, which is in the middle of a controversy right now. So, one app, many concerns. For starters, the app is being criticized for capturing far more data than is necessary for the purpose. Your response, please.
This is not correct. The app only takes basic data, and as been specified in the privacy policy of the app, all personal data is collected only once, and that is encrypted, and then a device ID is created. And subsequent to that, all interactions happens only with the device ID. Further to that, the app works on the principle of Bluetooth and GPS in order to ensure that we are able to find out who are the people who have come in contact with the COVID-19 positive person. As you know, COVID-19 is a virus which remains asymptomatic in most people. So this means that if you are infected with COVID-19, you might not show any symptoms. And when this happens, you might come in contact with other people without knowing that you are at risk, and you have the possibility of putting anyone else at risk. So what this app does is that if you have the app installed and your Bluetooth is on, and the people whom you are meeting, they also have the app installed and their Bluetooth is on, then it keeps on capturing your location data and your Bluetooth data along with the device ID along with the machine ID of the people you are coming in contact with. And this data is stored on your phone only. This data is not shared with anyone. Only in the case you are diagnosed as COVID-19 positive, then your location, your Bluetooth data is pushed to the server in an encrypted form, only with the objective of alerting those with whom you had come in contact in the last 14 days. So this happens. So like, for example, right now you have 9 crore downloads, out of which, if you consider that all those who are positive in India, which is around 45 to 46,000, so if all these, if the data of all these people are also pushed to the server, though still everyone who's been diagnosed COVID positive has not downloaded the app. So even if that happens, the actual number of people whose data is going to the server in an encrypted form is only about 0.05% of the total number of people who have downloaded the app. So it's this, all these claims with regard to it violates privacy and it collects data that is required more than what is required is incorrect. It helps in identifying the hotspots. It helps in identifying which are the areas where the health machine should focus, which are the areas where testing should be more, which are the areas in which which the health machinery and administration should sanitize. And all this is done only with the objective of saving lives.
I understand what you're saying, that only the COVID-19 positive cases, the data, their data goes to the service. Self-admittedly, the government has said that it is a contact tracing app. Now, tracking and tracing are really dangerous words, and they really ruffle a lot of feathers, especially of the privacy brigade. That itself is, they say that it compromises your data. The government is able to track you. It becomes a surveillance state at all times. How would you respond to those kind of charges?
It is totally incorrect. As I mentioned, the data with regard to your location stays on your phone. With your Bluetooth data stays on your phone. So anybody who thinks this is a surveillance tool is wrong. It's incorrect. The data only with regard to people who are tested positive are sent to the server only with the objective of alerting those with whom you have come in close contact in the last 14 days. There is no app which has got such a privacy features built in. The app is designed as per the privacy first principle. When you download the app, before you register, what all the app does, in what form it does, what are for how long your Bluetooth is exposed, all this is informed, and then all this is informed, and then the informed consent is taken. Then only you enter your mobile number, you get the OTP, then you register, and then only you get onboarded. So number one, the consent of the user is taken. Number two, it helps in identifying people with whom you might have come in close contact in the last 14 days. It helps the administration in getting to know which are the areas in which a COVID-19 positive might have visited in the last 14 days. Suppose somebody is turning positive today, but tomorrow he's gone to the market or gone to buy medicines or gone for any other essential purchases. That area, the virus may survive for 3 to 4 hours. So even if that person is not coming in direct contact with that person, we need to map the area. We need to identify which are the areas which are risky. We need to sanitize them. We need to clean them. And this is the only way we can flatten the curve. We can reduce the number of cases. And since the launch of this app on 2nd of April, we have seen more than 90 million downloads in the country. And this
Right.
app, when compared to other apps across the world, and India is not the only country which is using this app for contact tracing, whether it's Singapore, or whether it's South Korea, whether it's Australia, whether it's Israel, whether it's Iceland, almost Norway, almost all countries have an app to contact trace those who might be positive. And this is very essential. If we can't shut down the entire for a very long period, we have done the stay home, we have the lockdown for a very long period. Now there's a time to open up. So when you're opening up and when you realize that the cases may continue, how do you ensure that you reduce the impact of the virus? So this becomes an important technological tool to help us limit this pandemic to only those people who are infected, identify short hotspots, identify containment areas, and open up businesses, open up activities in areas which are not affected. So this is what the app does.
Right. So I want to talk about the French ethical hacker who tweets with the pseudonym Elliot Anderson. He had tweeted this morning that he had found a major security issue on the Aarogya Setu app. And this is not really the government of India's first run-in with him. Earlier, too, he had taken on the Indian government over the Aadhaar app. Your response to what he says.
His response to what he has said has already been posted on the social media. So when he posted it last night, after that only, because the government is committed to ensuring that the data and information of all Indians are secured, all Aarogya Setu app are secured. So even if somebody makes a claim saying that he has access, we would not let that claim go. We would verify that. So last night also, when this claim was made, the relevant cyber experts of the government, they looked into it, they found it, and they found that what the claim was made was not actually valid, because the app by design gives you the information with regard to number of people who are the users of the app, number of people who have tested positive, number of people who are in the Bluetooth contacts, number of people who have taken the self-assessment test, number of people who are coming out to be unwell in a vicinity of either 500 meters or 1 kilometer or 2 kilometers or 5 kilometers or 10 kilometers. This information is displayed for information of every Aarogya Setu user. So for example, if I have a app and I am getting the information that in my vicinity 500 meters, these many people are tested, are feeling unwell. So I can make a claim that in this area, I know that these many people are feeling unwell. So this is a claim which is not backed by any basis. It's an information which is made public for all users. And if I speak to you and I speak to somebody who is a bit far away from him and collect this all data, then I can also make that claim. But this does not mean that any data is compromised. This does not mean that privacy or any information or any citizen is violated. So if he makes any further claim, there might be many other hackers who will make such claims. But government is committed to keep the data of all Indians safe, and we will verify every such claim and ensure that the correct information is given for the users of this app and the citizens of India.
So, okay, fine. Thank you. Now, I'd like to take some questions from some of our viewers who are watching this show right now. And let me start with, there's this question posted by, if you see on your screen, by Anurag Lal. He says, what if I don't have a smartphone? Is the Aarogya Setu app also, relevant to people who don't have a smartphone? How do they use it?
Yeah, this question is very valid. And we know that in India, the number of smartphones is around 45 to 50 crores. And there is a large number of people who use feature phones. And then there is again around 11 crore people who use Geo phones. So for the Geo phones which use the iOS operating system, we are developing a version of Aarogya Setu which will work on iOS and the Geo phones. So that around 11 crore more people will be covered with that version of the app. Over and above, knowing that some people might use feature phones wherein the app cannot be downloaded, we have started the 1921 IVRS call service in which any user who has a non-smartphone, he can make a call at 1921, and with that it's a missed call. He can make a missed call at 1921, and immediately thereafter we give him a call back, and we do the same symptom checker that is done on the Aarogya Setu app. So it will go one by one. It will ask all the questions that is asked on the Aarogya Setu app, and depending on the answer that he gives, he will get immediately an answer about his health condition. And the government will also get to know if there are any people in any geography who are showing any symptoms which requires medical intervention. So this information is processed at the back end, and necessary administrative and medical action is taken in order to ensure that any feature phone user who doesn't use the Aarogya Setu app, who cannot use the Aarogya Setu app, is protected, his health is safeguarded, and necessary action is taken through the Aarogya Setu 1921 IVRS service.
Okay, I'm taking another question now from a certain Mr. Gaurav Kumar, who's written on Facebook. Why does Aarogya Setu need a phone number to register? Why email registration is not enabled?
See, it basically works with Bluetooth technology, and which would require a phone, and emails. The number of mobile phone users is much higher than the number of email users. So there are many people in this country who use mobile phones, but they may not use emails. So if you have a phone number based registration process, it's more inclusive. And if you have only email based registration, it will be like excluding a lot of people.
Okay, fair enough. I'll take the next question, which again gets me back to the data security concerns that are there. It's saying that data security is a concern here. Misuse of data by government for surveillance and tracking is the concern. Please try to differentiate. That's Gaurav Kumar. He's again asking on Facebook.
See, data security is not a concern here. Very happy to hear that. With regard to the second part of your question, as I have already mentioned, by design, all data remains on your phone. No data in most cases. In like out of 9 crore people who have downloaded the app, more than 8 crore 99 lakhs 50,000 people, for them there is no data which is going anywhere, because they have no reason to worry, because they are not COVID-19 positive. Data of only those who are tested positive is taken to the server, encrypted there, and with the only objective of alerting the people with whom you would have come in close contact in the last 14 days. Government is responsible towards ensuring protection of the citizens, and this also helps us to know where are the areas which we need to focus on. We are a huge country. We have a population of 1.3 billion people. And there might be more requirement of tests, more requirement of focus attention of medical doctors, medical infrastructure in certain localities. If we don't use data to kind of optimize the use of medical infra that we have, optimize our testing strategy, we will not be able to contain it the way we have. If today also you look at, the world 1 month back was wondering that where will India go at the end of April. People from very reputed universities were citing papers with millions of numbers and prediction models and all. Today we are at around 50,000 cases. So this has been possible only because of concerted effort of the medical workers, healthline workers, the support provided by citizens, the support provided by the entire machinery, in order to support provided by technology, to ensure that we are able to create awareness about the whole thing. We are able to forewarn people. We are able to drive in behavioral change, and to ensure that people in India are protected. So when the government is doing so much, one can only say that we have some trust in order to ensure that the objectives of the government are to protect people. And as the motto of Aarogya Setu says, मैं सुरक्षित, हम सुरक्षित, भारत सुरक्षित. So that is the objective with which this app is working.
I We received some questions before this debate started. We promoted it on social media, and there were people who cited concerns, a similar concern, saying Aadhaar when it started was also voluntary and then was made mandatory for public distribution or getting government benefits. So there are fears that this Aarogya Setu will also be made mandatory and going forward and lead to state surveillance. What's your response to that query?
See, Aarogya Setu is being launched for the specific purposes of containing the spread of COVID-19. The strategy that the government has, with which we are seeing that many states have reached a level in which the curve has been flattened. Kerala has done very well, Haryana is doing well. There are states in which the cases are much more. In India as a whole, also, if you look at the rate at which cases were doubling around 2 to 3 weeks back, we were at a number of 3.4. Today, we are down to a doubling rate of 13 days. So, if you look at the trajectory that the virus is taking, you look at the rate at which the cases are increasing, and if you look at the experience of other countries, whether it's China, whether it's Italy, whether it's US, whether it's Spain, whether it's South Korea, with the kind of Singapore, so with the kind of strategies which is there is a finite time limit in which this pandemic will be contained, and once that is done, there will be no need of such an app. So it's not that this disease is going to continue forever and this app will be required forever. Because so these are the things. Over a period of time, we'll be able to overcome it. Research is going on. We have heard about the research that our scientists are doing, collaborating with scientists world over in trying to develop a vaccine. So there will be a time, there will be in a very near future that this pandemic will be over. We'll have flattened the curve, and then there should be no need of such an app.
There's another question related because which said that earlier the app's privacy policy said that the government is not responsible for data leaks. That sentence was later removed. What is the status right now?
See, the government is very clearly stated in the privacy policy, and it's a standard draft that is used in any legal document. When you so the government is responsible for ensuring that all data is secure and all data remains on the phone in most cases, and only in some cases when you are tested positive, the encrypted data goes on the server, and there also the any interactions do not happen with your personal ID. So the personal information is 101% secure.
So I have a question also. So I've downloaded the app. A lot of it depends on my honesty, really. The app asks for a self health test or any other symptom that I'm showing. Suppose I'm lying, then what? How does that work?
See, what happens is that when you fill in a self-assessment test, and suppose you say that you are not well, this information comes to us, and then follow-up action is taken with regard to checking up on you, with regard to making phone calls to you, talking to you with the medical doctors who would ask, is it true that you are having these symptoms? And if you reconfirm on phone that yes, you are having these symptoms, help is given, testing is ensured, the local administration is alerted, the medical infrastructure, the medical teams in the various districts across the country are given this information. So as I said, whatever information you share is only used for medical interventions, and this objective of this app is to save lives, and towards this objective only any data is taken, and towards this objective is only saved. If somebody is unwell and he fills in the wrong data and he fills in that he is safe, then there is little that the app can do, but we expect that people will not do that. Advisories are given, we have videos, we have promotion, we have videos on the app also where you can see what to do, what not to do. There are videos about wearing masks, there are videos about social distancing, and if people have symptoms, they will seek medical help at some point of time.
Okay, so basically you're relying on the basic goodness of people and the honesty of people that they will be honest while making their self medical assessments. I'll take another question here from I'll take another question here from a user. Uh, Sorry, it's moving fast. So basically, somebody was asking here, which I can't find that question now, that Why can't you make it open source? Why are we keeping this in the mood that it is right now?
See the
The
policy of
source code, yeah.
yeah, see the source code over a period of time. If you would have been using the app, you would have realized that this app was developed in 2 weeks' time. This app has had certain features to begin with. A lot more new features have been added up. Around when the initial launch was there, you were not able to see how many cases are there in your neighborhood. 500 meters, 1 kilometer, 2 kilometers, 5 kilometers, 10 kilometers. So all these things have been added on in the period of time. There are other more there is a request and there is a demand for other services to be added. There was a suggestion that e-passes should be added. There was a suggestion that telemedicine option should be available so that people can access help when they need. So when the app is having the basic functionalities and when more features are being added day in and day out, what we want to do is that to have the complete app stabilized with all the features that they are, and then they put it. Otherwise, just like somebody yesterday came up with some random claim, every day we will have, the moment we put this app in the open source, there will be people who will be coming up with random claims about this happens or not, that this doesn't happen. And we do address every such issue raised with due attention. So, but then the point remains that the time of the technology team is spent in doing that also. So, what the team is doing is to ensuring whatever we are promising, ensuring that whatever we are delivering is of the top quality. And also, we also had this instance of a friendly neighboring country who launched a similar thing with an APK file and tried to steal data from our citizens. The moment we put it, there are also concerns like, will somebody replicate something similar and try to fool people? So we are responsible from all ends. And as I mentioned, that the policy of the government of India as such is of open source and open standards. So once this is done, there is no reason it cannot be put in the open source.
Okay, so I'll just take one last question. That's all we have time for right now, and that is of Ishan Shrivastava. He's asking on our YouTube channel. Ishan basically is saying that all data you're saying that all data will stay on the device, but in the terms and conditions of the app, it is written that data will be shared with Government of India. Why is that?
See, as I
I mean,
mentioned,
it's a
for
good
most
question. Yeah.
people, as I said, I'm repeating it again. For most people, the data will remain on their app, on their phone only. Only in the case you turn COVID-19 positive, only in such cases, the data with regard to your Bluetooth data and your location data will be shared with on the server only with the objective of alerting people who have come in close contact with you. To that objective, we are being proactive and ensure and mentioning that if the data is shared, it will be shared only with government, only with the objective of medical interventions, and for no reason other than that. No, and I'll give you the numbers. Out of 9 crore people, only about 50,000 people roughly have been tested positive. So even if all of them are on Aarogya Setu, which they are not as yet, that is only 0.05%. For 99.95% of people, no data is going anywhere. So there is no reason to have any apprehensions. And the other fact is that this app works the best when most people have it. And when the lockdown is relaxed, when offices are opening, you would like to know that if you are interacting with someone, if you are buying milk from a milk vendor, if you are buying medicines from a medicine shop, or if you're buying groceries from a shop, you would like to know that the person standing next to you, is he like safe or not? So this is what this app does. It alerts you if you come inadvertently in contact with anyone who has later tested on COVID positive, it will alert you. So it is only for the safety of people, and towards this objective only this app has been designed. It was designed in 15 days, less than 15 days. It reached the download levels of almost 90 million people in around a month, which is a record for any such app anywhere. And it has been the result of the finest minds within the government, within the private sector, within the academia, which has helped to lead us to that. So what I appeal to everyone who has joined on this show today is that please don't have any apprehensions. Download the app, use it, keep the Bluetooth on, and ensure that not only you are safe, your loved ones are safe, and the country is safe.
Thank you so much, sir, for joining us. That was Mr. Abhishek Singh, CEO of MyGov, answering all the questions related to Aarogya Setu app. Of course, there is still the matter of the French ethical hacker Mr. Elliot Anderson, who's promised to release some sort of documents by tonight, based on the responses he's got from government so far, and that he's in touch with the Indian government. Let's wait and see, sir, what he brings to us, and then maybe we can come back to you with some more questions. Thank you so much for joining us for this broadcast. Keep watching HindustanTimes.com.
Thank you.
Thank you.